Welcome to our Global Skin and ILDS webinar. Thank you all for joining us today for a really special webinar. We're once again co-hosting with our friends from the International League of Dermatological Societies, the ILDS. Before we begin, my name is Elfie Deprez, and for those who don't know, I am the Member Services Manager of GlobalSkin. I'll be moderating today's webinar, the important role of nurses in the management of overall medical pathways of dermatological patients with Elfie Deprez. I'm really happy that we have the chance to connect during this global health crisis, and I know we all will learn a lot from the ILDS, from Elfie, as well as ourselves, and our discussions with one another. Before we begin, I'll go over some details. We will be recording this session. It's going to be on our website for the public to view. And today's session will be about an hour long. Ms. Deprez will take the first 20 minutes of the session to share her expertise. And then we'll have about 40 minutes at the end for discussion for all of you to ask questions and share your experiences. To maintain bandwidth during the presentation, we will be removing everybody's videos and muting participants as well. But please feel free to use the chat pod feature at the bottom of your screen to ask any questions or comments during the presentation. I'll now leave it up to our Executive Director, Jennifer Austin, to introduce Dr. Luca Borodori from the ILDS.
Thanks, Nicole. So we're really pleased to have Professor Borodori here with us today. I'm going to give you a brief outline of who he is, and at the end maybe tell you a little bit about why he is really an important person for our organization to be working with. So Professor Borodori graduated in Bern, Switzerland, and completed his training at the University Hospital St. Louis in Paris and at the University Hospitals in Lausanne and Geneva. He worked as a postdoctoral fellow at the National Cancer Institute in Bethesda and at the Netherlands Cancer Institute. In 2008, he became chair of the Department of Dermatology in the University Hospital of Bern. He has been backed by the Swiss National Foundation of Research and the European Research Framework programs with publications of over 250 articles in peer-reviewed journals. He has robust international engagement, and this is reflected in his commitments with the European Academy of Dermatology and Venerology as its president in 2016 to 2018, vice president of the ISD, that's the International Society of Dermatology, 2014 to 2018, and as well as a board member of the International League of Dermatological Societies, the ILDS, which is our co-host today. Professor Borodori also chairs the ILDS's Patient Organizations Working Group, and GlobalSkin is a member of that working group, so we do work closely with Luca. And we'd also like to say that Luca is a champion of the patient voice and patient organization involvement in the work that's being done by the ILDS as well as the EADV. And I will never forget when we did a joint presentation session at the EADV Congress in 2018. Luca actually came to the podium and talked about his commitment to patient involvement in organizations like the EADV, and that certainly extended it well into his work with the ILDS. So we're really grateful for Professor Borodori's involvement in this session today, and so welcome, Professor Borodori.
Jennifer, thank you very much for this very nice and kind presentation. So I feel a little bit so shy now after. Thank you very much. But so it's my pleasure, together with the EADPO, that we are able to promote and provide with this series of webinars. And the webinars are aimed in order to promote knowledge about access to care, patients' rights, patients' expectative, patients' needs, and in order to promote the patient's interest and rights, it's extraordinarily important that there is good partnership and good exchange among the various stakeholders. And I think the stakeholders that sometimes are somehow forgotten are nurses. However, nurses play really a key role in managing patients, are probably the person who have even much more close contact, and they have a different and a different perspective on patients' expectation, patients' needs. That's why, together with Jennifer and the EADPO, we thought that it was very important to invite a very experienced representative among nurses, and we had the chance to be able to invite Elfie Deprez, who is a head of the nurses of the Department of Dermatology in Ghent, in Belgium, and she's very active at the national level in Belgium and at the European level in order to make more aware about the expertise and specific knowledge of nurses in the comprehensive care of patients. She's very, very active. She's involved in research programs where she tries to emphasize the added value of the nurse implication in taking care of the patients. Uh, uh, she is actively involved in the European Academy of Dermatovenerology in the working group of the nurses, so working group in order to promote also the involvement of nurses in lectures and in promoting education. And so I'm very happy that she today she will give us her perspective. So I thought that was very important for patients to understand the key role of nurses and how nurses can really improve to a better global evaluation and also an understanding of treatment and support at various levels. And I think Elfie has a huge experience, and we will all profit. And before Elfie starts, I Somona of the EADV staff and my more important person behind the patients working group who make everything possible for our work has just prepared a 2 or 3 slides just to remind our goals of the International League of Dermatological Society, which is the society which regroups all international society on the world of dermatologists. And of course, you see we have many common overlapping thoughts and objectives with the International Alliance of Dermatological Patients Organization. We want to attain the best possible skin health for all people around the world, and we want to increase awareness, cooperation, and communication within the global dermatology community to promote good education, good clinical care, research, in order to improve skin health globally. But this, of course, together with the patients who are our, as you say nicely in French, our raison d'être. Probably in the next slide. So just here our three of our main missions of the ILDS, our partnership. We want, of course, to have collaboration with the leadership and the various stakeholders to have also impact on policy and policymakers. We want to represent dermatology at various levels and engage in various initiatives and projects. And we would like, of course, to promote education and better care of patients with skin diseases. Here are a number of our main objectives is, for example, to prepare the World Congress of Dermatology, which takes place every 5 years. We have a very important engagement in humanitarian work, and this is made through the International Foundation for Dermatology. And the ILDS is the organization which represent dermatology with the World Health Organization and has a number of main issues which are dealing in order to promote improve management of patients with skin diseases worldwide, including access to essential medicine. And here you see just what is our goal as a patients organization working group of the ILDS. We want of course, to foster exchange with all patients' organizations worldwide. We would like, by this exchange and collaboration, trying to build strategic alliance to have common voice in order to have a better impact with the various stakeholders. And of course, we want also to support the patient's engagement in all kind of educational program, because it's very important that we always keep in mind the patient's perspective. So no decision about me without my opinion as a patient. So this is very important. But after this number of slides, I think that I have to leave absolutely now the platform to Elfie Deprez. And I would like again to thank her availability, and you will be, I'm sure, I anticipate that you will be very interested about the world and the view that and the experience that Elfie is going to present and share with you, with us.
Okay, thank you, Luca, for all your kind words. I'm very flattered. And I'm very happy to have this opportunity to talk today to all those patient organizations all over the world. It's the first time I give that international talk over all time zones in a webinar, so it's a new experience for me. And I hope I can be of added value, not only to the patients, of course, but also today for you, for the patient organizations. Let's start the presentation. So here you can see a picture of my hospital. It's in Belgium, it's in Ghent, it's a beautiful city. Unfortunately, due to Corona, nobody is able to visit it. And you can see here me working in the consultation room with the patient. I'm mainly focused on psoriasis. Of course, I have a good view over all dermatology pathologies, but my focus is psoriasis. And you can see our psoriasis team, and we focus on consultations on clinic, but also we have a strong research program. So I'm not here to convince you why we need nurses, but it's clear that care has changed a lot over the last 20, 30 years. It's really becoming very, very different than before. We have to work more together with other disciplines, and patients are becoming more active, more engaged, which is definitely a positive evolution. But it means also time have changed, and we cannot only focus on the disease, but we have to look at the patient as a person, as an individual. And I think over the whole globe, patients are becoming more older and with more and more comorbidities, but that makes care more complex. And fortunately, we have also more and more research, more and more evidence, and we know now that we have to work more on prevention. So we have to work proactive and evidence-based. And due to all those comorbidities, we have to deliver integrated care. So we cannot only look at our own specialization, and we have to look at the patient with all his comorbidities and coordinate care also with other disciplines. And before I speak decennia ago, doctors were looking at how many patients could I help today, but now we are looking to healthcare, and we want to know how good is the care, what is the quality of care, and we want to measure it, we want to know it. So that has definitely changed, but if we look what we expect from our doctors, from our dermatologists, it's a long list, and I am convinced that it's a big, big challenge for dermatologists to work that way and deliver high quality care, very integrated, very person-oriented. In a consultation of maybe 15 minutes, it's a big challenge. And I think we nurses can really help out them, and in that way, quality of care can really be increased. So, and here I believe, and you also all believe it, we have to place the patient in the center. And the dermatologist will always be the expert on the clinical examinations, on recognizing the pathology, on diagnosis, on knowing all the details about the available treatments, about the treatment decision. That's what they are really, really good at. But patients have other comorbidities, they have a personal story, they have triggers of their disease, they have quality of life impacted very often. And for those things, I believe nurses can be an important added value. And of course, we have to work together with all other healthcare professionals of that patient. And I believe the patient organization is a very important partner in our care, because as a patient, yeah, it's important to hear let hear your voice and to express what your needs are. Of course, as an individual patient, you have a voice, but if you can unify all those patient voices, it becomes louder, and you can really have impact on care. So as I was talking about the roles of the nurse and about quality of life, for example, but I have tried to define the things I think are important from my perspective as a nurse. So it's not evidence-based, it's really my point of view based on my own experience. But I see myself as an important educator, because when I educate patients about treatments, lifestyle, comorbidities, treatment options, it takes time to explain a dermatology disease into detail, which options they have, which risks there are in the treatments. And if you really want to explain that very good, it takes a lot of time. Also, when patients come in the consultations, they already have a history. They already have expectations. Often they have beliefs about treatments. Sometimes we see very, very strong corticophobia, for example. It's not something we have to deny, but it's important to talk about it. And in that way, we can increase adherence. It has been shown in evidence also. And if we want to talk about lifestyle, we have to promote self-management. And as I said, care is becoming very complex. We have to measure a lot of things. We have to fill in a lot of files. And in that, we can support the dermatologist also. And maybe the last one is the most important one is I feel a lot a counselor in that way that I want to be a single point of contact, so like a Spock for patients, that they know that they can contact me in between visits when they have concerns or questions. And I really try to listen very actively to their story and to their questions without any judgments. And we discuss scores about quality of life, the DLQI, their anxiety and depression scale. And I feel a lot of patients talk very, very easily about it with me as a nurse. This morning I had consultations, and I think of the 9 patients that I saw, I think 3 of them were very, very open about their relationship problems, their problems with their partner. And sometimes I'm even surprised that they are willing to talk about so many things about their private life with me. Okay, you could discuss about the fact, is that really relevant? But since we are talking about psoriasis, often we see a strong link with outbreaks of psoriasis. So it's important that we know that it's maybe not only treatment that is failing, but there are other factors playing. So it's very important to fulfill all those roles, and I'm convinced as a dermatologist, if you have to do that in 15 or 20 minutes, it becomes a very, very big challenge. So part of the presentation was also, okay, how did this role change, or what was your role during the COVID pandemic? well, I felt that all roles stayed, well, the roles are stayed stable, but the way we filled them in changed a lot. And I had the feeling that the collaboration with the patient organization became even more important. As you can see, the 4 roles that I have written down for me are also 4 important roles for the patient organization. And maybe one of the most important one for us during COVID was patient organization helped us spreading the right information, because patients had a lot of questions, a lot of concern, of course. And in the beginning, we had a lot of emails and we answered them one by one, but it's really an added value then to have patient organizations who can inform patients, take away a bit of their concern, or at least give them the good, right information that they can trust on. And I believe patient organizations can also facilitate the way patients can find that right information or have access to care, because during the first lockdown, I think in many countries, access to care became more difficult. So, and maybe a lot of patients became scared to come to the hospital, and it's important to guarantee access to care, although you can say, yeah, psoriasis was maybe not the crucial, or dermatology was maybe not in the eyes of the public, maybe not a crucial disease during the pandemic, but patients had their concerns, their fears, their treatments they wanted to continue, because, and then it's really, really good to have a strong patient organization that can help and deliver the right information. So I've been talking a lot about the added value of the nurse, a lot of my own experience and opinion, but of course it has been shown and this is only one article, but it has been shown in research that nurses really do have a positive impact on dermatology care, and they have a really essential and relevant role. I won't go too much in detail. One of the questions of the presentation of today was, how do you engage your healthcare professionals, particularly nurses, in outreach to patient communities? And I really had to think about that question. Like, how do we do that? Because of course it's something that we all, or at our hospital, we believe is important. But I thought maybe it's better when I show it with an example rather than I keep just talking about what I think. So I will show you an example that we are working on here. I started my PhD 1 year ago, and of course, the goal of my PhD was I wanted to show that in psoriasis, but you can, make it wider to chronic dermatology disease. I wanted to show that nurses can really fill in unmet needs from patients. So when I started my PhD, I started looking into, okay, but what do patients really need? Because of course, a lot of the evidence, a lot of the things we think come from ourselves. We think that patients need the X or Y or so. And I found one really good article of psoriasis, but I think it's not very specific for psoriasis. A lot of things will be applicable on other dermatology diseases. But for me, it's really a key article, because when I read it, it's from Denmark. I recognized everything that patients said in the interviews, and it reminds me really sometimes when I think, why am I doing this? It reminds me why it's this important to keep striving for the patient's needs. So in the interviews, patients stated that, and now you have to click a lot. What they said is we have a strong need for support for individual issues, but we did not seek for it. And that was really a common thing in all interviews. that patients emphasize on the fact that they want individual care. They try to address psychosocial issues during consultations, but sometimes they see that physicians don't really know how to react. And even sometimes minimize their issues. And then by, for example, comparing that one patient with another one who had even a more severe outbreak. And of course, as a patient, you don't feel recognized at that moment. And as I said, they have a strong need for an individual approach. And of course, that's in conflict with consultations which are often very structured and organized, because there's no time to lose, of course. And those two things, individual approach and then very structured organization, you feel the tension between those two things. And as I said, yeah, often it's a fact, and even sometimes I have the same problem, that yeah, the consultation is centered on the physician or the nurse, sometimes even controlling the pace of the agenda. Sometimes when I don't have any time anymore left, I have to look into, okay, how can we stop the consultation here, although you feel that patients still have some needs. Yes. So the main themes of that article were that patients have very individual needs, and they have a need to have hope on efficient treatment. So many patients had the feeling that it was sometimes hopeless. So really, literally, there was no hope left for them. Because they have fear that it would come back, or that treatment wouldn't work again, or that the treatment would have very severe side effects. And all those concerns, they often felt that they were not really addressed in the clinical consultations, and even resulting in patients not even starting with their therapy because they felt too many fears about it. And no, that's too fast, sorry. Yeah, so they ask for individualized health education, which is important because sometimes we have really the idea, okay, let's have a group session with patients, which of course is very relevant, especially I think for patient organizations, but in clinical care with doctors and nurses, patients expect an individual approach. And for me, for my research project, it was very interesting to know that patients really ask to be encouraged in changing their health behaviors. So, and they really ask our support to guide them in changing their lifestyle behavior. So you have seen a lot of needs. I think many of them are not psoriasis specific, or really consultation needs, dermatology needs. Even outside dermatology, I think you will find the same things. And we feel there is a gap between what patient needs and what a doctor can deliver in that limited time slot. And so I believe that the nurse could fill an important part of that gap. Maybe not everything, but also definitely some relevant needs. So when starting my PhD, it was very important for me that unlike many research projects, I started from my own experience thinking, okay, patients need this and that, and now I'm gonna design this for them, and I'm gonna measure if it works or not, because a lot of the research is done that way. No, I had to take a step back, and I will do many interviews with patients. I will film all those interviews. I will do the same with the healthcare professionals, so also dermatologists, nurses, even GPs, so to have a real complete image about the needs in healthcare, the needs of patients, and where we can find a common ground, and what is feasible and not, and what are the most important needs of patients, and in which needs do they accept care and support of nurses. So I will do probably around 20 or 30 interviews. We will do observations. We will film that, and the interesting thing is we will select the most important fragments and make a movie out of that, and then we will have group sessions, patients together, staff together, or we could skip that step and we directly go to a joint patient staff meeting, and that's probably what I will do. Possibly we will need maybe 2 or 3 meetings, but we will bring together patients and healthcare professionals and really look to the videos and look what patients say and look into what healthcare professionals say. And from that, all those themes, all those needs, all those barriers, we will start selecting items, topics, priorities, and we will design together with patients a program. And I decided, or I have chosen lifestyle and treatment as 2 themes. But suppose that patients say, oh no, lifestyle for us, it's not a priority. We want to emphasize on comorbidities, for example. It's also a possibility. I have now 2 concepts in my head, but of course, if patients steer my research to something, other themes, it's also okay. But I wanted to show this because experience-based co-design, it's how it's called, this methodology. It's from the NHS, from the UK. And I think it's a very beautiful concept because it really brings together not only patients, and staff, and you can really improve care together. And by adding the healthcare professionals, it makes that they will believe in it, but also that it's feasible. Because what you see a lot in research, and that's a very big pitfall. My PhD is 3 years, and I can have a beautiful program, but the day that my research project stops and the resources, the money is not there anymore, or there's no researcher to guide the program, many of those projects are limited in time, and after a couple of years they stop, even though it has been shown to work very good, and it has to be feasible and sustainable on a long term. And that's the big advantage of bringing staff and patients together. You make it a feasible program that's sustainable over a long time, and that everybody believes in it because it's created together. And in my opinion, okay, this is a research project, it's my PhD, but it could be even a project or a program that patient organizations make together with healthcare professionals. Now, in this case, it's a healthcare professional, it's me, who is leader of the project. But when I thought about it, it would be a very beautiful example for patient organizations also to really have impact in care. So, and even the next step, so an idea we have is to involve experts by experience in our projects. So maybe many of you know it or not, I have no idea, but it's a concept. So experts by experience means you will involve patients in the care delivered. So you have a consultation with a nurse, a consultation with the dermatologist, and then patients can see another patient during the pathway of the consultation. And you, experts by experience, know more about the disease than many beginner patients. So, and in that way, they have a sense of recognition, and they feel that, yeah, they have somebody in the consultation that really understands them. So, and that's an idea. It has been tested already in atopic dermatitis some years ago here in Belgium, and it had positive effects. So maybe we will do that also. Thank you. I hope you found some things interesting. If you have any questions, I think we have time for that now.
Thank you so much, Elfie, for your presentation. I really appreciate you spending the time to share your experiences, your research with us.
I would like to thank Elfie for this very interesting presentation, and I would just to underline as a physician how also for me is important to always get the feedback of the advanced nurse practitioner or of the specialized nurse in order to better take care and understand the patient. And you know, for example, in Europe, we are a very heterogeneous population, which makes from one side is a richness, but on the other side, it all sometimes challenging. And in Europe, we have countries in which nurses have a very good and strong position and are very well recognized as key elements, as a key person in the patient's management, particularly so in Belgium, in the Netherlands, in the UK, whereas in other countries like in Germany, they are much more reluctant in recognizing the role of nurses. But at least in Switzerland, we are a little bit in the middle between UK and Germany in this sense. I really have the impression that the patients highly regard and are really very, very happy to have a nurses as a reference person giving another perspective, having another perception, another sensitivities about the disease, and they are exactly as Elfie say, more ready and available to discuss about certain problems that they were somehow shy to express with the physician, not only because of time issue or agenda issue, but I think that indeed the management and the comprehensive approach to the patients and patient perspective can be really improved by the presence of a nurse with specific expertise. And so, and this is something which I've also learned with the years. So this was my comment more than a question. So I leave so I experience every day what Elfie say as really something critical in order to better understand and better follow and have better trust with the patients.
I want to say thank you so much, Elfie, Dr. Boradori, and of course everybody who's had the chance to speak up and participated in this webinar. I've personally learned a lot from this, and it's great to see so many faces.